Hello everyone. Today we are talking about a revolutionary approach to implant dentistry, and we're talking specifically about replacing missing teeth with dental implants. We are joined by Dr. Shawn Keller, who has pioneered this new approach. Dr. Keller, thank you so much for being here.
Thanks for having me, Kristen.
I'm thrilled to be able to talk about the amazing work that you are doing, and we really want to get right into talking about the same day new smile procedure. This is amazing, and I really want to know who's a good candidate for this.
Great question. The main people who are candidate for this are people who are already in a denture and they don't know that there's a better treatment out there. So if you've got a denture, you're slowly losing bone every year. And with this procedure, you can come in and one day we add the implants and we create the teeth instead of the denture, so you have a set of fixed teeth that day. Wow. The next group of people are people who are headed for a denture. They've got gum infection, they've got infections around the teeth, the bone is not very good, and they know they're headed for one, but they're just dreading the thought of having one. And so those patients come to us, and in one day we have the teeth out, we place the implants, and we screw in your final teeth that day.
That is incredible.
Well, yeah, and the best part about that is the alternative is, as you know, you've probably looked at implants, and usually you have to get a bone graft, wait 6 months, get an implant placed, wait 6 more months, then you actually start getting the teeth in. With this procedure, we skip all that. In one day, we take out the bad teeth, place the implants, and you get your fixed teeth that day.
That is just so amazing, and really taking the hassle out of it by being able to do this so quickly and efficiently. And I know that a lot of this has to do with the amazing technology that you have in your office. So we're going to actually show some of that technology. Tell me about that 3D digital scanner and how that helps you.
Okay. The 3D scanner is a really cool new technology where we actually have a few of them there at the office. One of them, we scan the teeth. So we, instead of taking those big goopy impressions where you gag and you bite into that,
I hate those.
You have to retake them. They take about 10 minutes of sitting there gagging with it. We just have this little gentle 3D scanner. It almost just looks like a little toothbrush, and we go and we scan the teeth, and we get this highly accurate copy of your teeth from that. The other scanner we have is this really cool facial scanner. So one of the biggest problems with this type of dentistry is you're designing a whole smile for the face. And so other places that do this, they put the teeth in and it's off this way, or it's too big for the face, or it doesn't fit. We have a 3D version of your face right there. And so we design our smile based off of that. So we have your 3D impression, the 3D scan of the teeth. We have the face right there. I have the 3D ICAT cone beam of all the bone. All that together allows me to virtually do the surgery beforehand. So we place the implants on the ICAT virtually. We place it within the new design smile, and we have your face right there. So it eliminates this 6 months of try-ins and fiddling with everything. The first set of teeth goes in is just amazing.
That is just mind-blowing, really.
There's a third type of patient that's a candidate for this that I forgot to mention is even if you're not headed for a denture and you need 2 implants here, 1 here, you need a bunch of crown and bridge, and you're sitting there looking at the amount of cost and the time that it's going to take to do that. Even if you're not headed for a denture, this is still a great procedure to avoid going through all these different surgeries for the separate implants and the veneers. With this, we every now and then you take out a few of the teeth in between, but it allows you to get one beautiful piece and gets your same smile on the same day.
Yeah, and for me, I always think about that convenience piece. You know, nobody wants to keep making appointments and finding time in their schedule to fix this and then fix that. So the fact that you can do this just in one day and eliminate that headache, even quite literally, which we'll talk about later,
yes.
It's just really, really improving the overall experience beyond the appearance, beyond the pain, just making it so, so convenient. And you have such a beautiful office, and we're going to talk more about your staff in a little bit too, but I do want to show people the beautiful setup that you have there in Kirkland, and I'd love to hear a little bit more about what the experience is like and what people can expect when they become a patient.
Oh, very good. So Most of our patients come from out of town to do this. We have people flying from out of state, even out of the country, to do this. So we've really streamlined and refined our process to accept that. So a typical patient will deal with them with a Zoom call or a video conferencing to learn about them a little bit. Maybe they send us a few x-rays if they had them, but we don't necessarily need it. We decide if they're a candidate. So they'll fly out to see us maybe on a Tuesday. We'll do the consult, do the exam, get the scans we need. We'll design the smile that night virtually. We'll be ready to do the implant surgery the next day. Your teeth go in that day, and the day after that, we refine it, make sure that it fits and flows with your face, and you're flying home by Friday with your finished teeth.
Wow, they must be so excited that they can just get that all done in one stop there. That's amazing. And there's some stuff that people come see you for, because even though they live somewhere else, because you do some very specialized procedures, right?
Yes, yeah, thank you, Kristen. Like one of them that I'm really excited about is seeing patients in the Seattle area for almost 25 years now. When the patients fly to see us, my motto is no dentures. And so my other places that do something like this, you're wearing these removable flippers or partials or Invisalign trays with teeth in it, and you're waiting 6 months to a year for the bone to heal, then the implants to heal. And my motto is no dentures. Like, we're going to put these in and it's going to be awesome the same day. So every now and then a dentist would refer somebody to me because they've heard about us, or somebody's seen our videos of our happy patients, and they fly out to see us, and I would see just horrible blown out bone in the back, just infection. It's really soft. It's like only an eggshell of bone, or maybe it's very soft and infected. And I really, really wanted to deliver what we talked about those people. So I decided I needed to go back to school. So I flew to Australia and did a residency in Melbourne there. I did a residency in Barcelona, did another one in New York, and we learned how to do these really cool high-tech implants where if the bone where the old teeth is not good enough, we angle it out to where the cheekbone is. And there's some other areas where we do these designer implants that allow me to deliver this for every patient, no matter how complex.
Wow, it must be so amazing for you to be able to not just help someone with their smile, but really help them improve their overall quality of life. And as we pop up some before and afters, I want to go and talk about the transformation that they had in their smile, but also a little bit about how it changed some of their lives behind the scenes, stuff that you wouldn't tell from just a picture. So I think our first picture that we're going to show you here is Leanne, and her whole life changed after you worked on her beautiful new smile.
Yeah, so Leanne came to me and she had a tough situation, and she brought me some of the treatment plans she had from other dentists, and it involved maybe 8 to 9 implants on the top after sinus lifting and bone grafts. So she was looking at not getting any teeth for almost a year, and tremendous cost for all these extra surgeries. She probably had 3 to 4 different doctors she was going to have to see to get these procedures done. And it was just, she's not willing to go through that. So she heard about what we do, and she came in, and we were able to have the bad teeth out. We use stem cell therapy to make it heal a lot faster. We were able to have the bad teeth out. We placed the implants in. The teeth went in that day, and just look at her. I mean, it's called the same day new smile. She left looking like that after about 48 hours. And she got married after this. She invited us to the wedding. She couldn't date before.
And you know what? That is such an important point. People don't feel comfortable putting themselves out there when they don't feel comfortable smiling, or maybe they're not as approachable because they don't seem as friendly, when really all it is that they're not confident in their smile. And she went on to have a baby at 40. I mean, you truly changed her life.
Yeah. I mean, it's really, really powerful to do this, and it feels like, for me, I really enjoy making these big changes. Early on, I've been doing this close to 25 years now, and the way that it's generally done is the people come in and you're bone grafting, placing the implants, you wait. You're a tremendous amount of cost, and you haven't even addressed the other teeth that aren't implants yet. And so these treatment plans take forever, and it's discouraging as you go through it. Even when you're excellent and you're doing it the right way, it's just a lot to go through.
Yeah, that's such a good point, is there is a mental toll to that, and trying to fit it into your life, and just the fact that you're able to do this so quickly is of such great benefit to your patients. And I do want to show another picture here. We're going to talk about Roy. Look at it, he's just beaming. You can see he just looks so happy. I mean, mean, he looks like he's a pretty friendly, happy guy in general, but he is just glowing.
Yeah. I mean, he looks really good with the smile. His main thing is he wanted to be able to eat the foods that he enjoys.
That's a big deal.
Yeah. He's a Hawaiian dude, and he likes his Hawaiian foods out there. And it was very painful when he would eat. Some of those teeth were loose, and he had a lot of pain. And so, giving him a solid set of teeth that he can eat whatever he wants with, and bite right through that pineapple.
Oh yeah, absolutely. Good for him. And then Sally is a transformation that I absolutely love because Sally looks like she's Sally's daughter is what we were saying as we looked at this photo earlier. I mean, just everything about her. She is absolutely beaming in this after photo.
Yeah, well, again, she was looking at she brought me in some plans that she had, and she was looking at getting bridges, bone grafting, implants. It was a very, very long treatment plan, and it still wouldn't even give her the smile she wanted. With this plan, she came in, and again, it's the same day new smile. It's a little bit different for everybody. Of course, it's very customized for that person depending on their needs and what their situation is, but the main result is the bad teeth come out, the implants go in. That day we put in the prototype, we refine it, make sure it looks good, and the next day we put your final teeth in.
I just see her eyes, and she just looks like they're sparkly. She looks so full of life.
Oh, could we show that? Yeah, could we show that picture again?
Yeah.
So if you look on the picture on the left there, when you've got dental infections in there, even if it's just one or two teeth, that's an abscess. That's a little pot of bacteria in there. And your body's trying to fight it, but it's leaching into your lymphatic tissues. It's leaching into your blood vessels. Your whole body is sitting there trying to fight this. You can see it in her eyes.
And I notice her skin, too. I notice a big difference in her skin as well. She just overall looks healthier.
When your body's not sitting there fighting the periodontal disease and these abscesses around the teeth, now it can focus on just regular maintenance of your body, on staying youthful and feeling good, since you're not fighting this infection anymore.
What a stunning transformation. And then also we want to show a picture of Mike, and I love in this picture he's got the apple in his after, because it is awful when people have these dental issues and they can't just bite into an apple. That is so bad for your quality of life, and you can tell that he's thrilled there.
No, I mean, yeah, Mike's a buddy of mine now, and his was a really fun case. I believe he came in, and his plan, he was supposed to have something like 4 or 5 implants on top, maybe 3 or 4 on the bottom, and a whole bunch of separate crowns. The bad thing about that is, even after he did the implants and restored the remaining teeth weren't going to last very long. He would have spent all that money on it, and then the other teeth in 10 to 15 years were probably going to fall out and need implants too. So why spend all that time and money, and 10 years later you're going to have to redo some of it anyway? Beautiful thing about this plan is he's going to go to the happy hunting ground with those teeth. Those are gonna outlast him, guaranteed.
Well, it has been amazing hearing about these transformations from you, Doctor. But actually, right now, we want to hear from Mike Daniel himself about what this whole experience with Dr. Keller was like.
My name is Mike Daniel. Early on when I was young, I raced motorcycles, and I had a bad crash, knocked out 3 of my front teeth. I actually had teeth dangling from the nerves when I went into the dentist, and I spent 5 days in a chair while they did abutments and put crowns over those. And so at that time, I think I developed a fear of dentistry. And then over the course of years, raising children, paying for college, doing all those things, I let a lot of times my own dental care go to fund all those other life expenses. So after days of researching on the internet, I came across Smiles by Design and started reading up about Shawn Keller, and found out he was an artist, and I happened to collect some art, and his artwork reminded me of one of my favorite artists, Daniel Wall. And so I started to delve into his website, and I really thought this was a good match for me. I just felt really confident in this person, their skill, their ability, their whole thought process towards treating people and the problem with their smile. And so I went for a consultation, and I met Shawn, and I knew I'd landed in the right spot. I wish there would have been a way to find out earlier that it wasn't as bad as I had made it up to be in my mind. So for me, the pain was a big fear factor for me, and I found that the actual pain I had the next day following the surgery was about 10% of what I expected it to be. So the next day when I came back in to see Shawn and have him check on how the implants and everything were doing, I told him that he was the only person I was ever going to forgive for making my mother cry. And he looked at me questioningly, and I told him I had sent her a picture of my smile, and she had commented that she hadn't seen that since I was 20 years old. And that made my day. At the end of it, I go, why didn't I do this 10 years ago?
You made him the happiest man in the world. How does it make you feel to see that?
I mean, we work tirelessly to do this. I'm up at night with the lab and designing the smile virtually. We do the surgery during the day. When the teeth go in at the end of that day, I mean, it's a celebration. Just, yes, you know, we know it looks good when we show them that mirror and they smile the first time. We know it's the first day of the rest of their life when we do that.
That's so incredible. And this is really personal for you, isn't it?
I mean, it's like everything that I've done in my life, I feel like it led to this procedure. It's got like, I was kind of a video gamer growing up, so that falls into the digital design of everything. I'm a bit of an artist too, so I like a lot of the paintings you see in the office I did, and I kind of feel like the patient's face when I'm trying to blend this smile with them. I mean, that's my canvas right there.
Tell me how you ended up in Kirkland. Are you from that area?
Yeah, so born and raised in Kirkland. Actually, the building that we're in now with the clinic downstairs and the laboratory upstairs is literally 2 blocks from the house I was born in.
Oh, wow.
And so, I went to Catholic school at Holy Family right by there, went up to Western in Bellingham for undergrad, then UW for dental school. And then I started practicing right after that, got into heavy TMJ complex cases. I liked helping people with migraines and headaches and bad jaw problems. As I did that, I realized a lot of these people needed some cosmetic work and some implants. So I went back to school to learn how to place the implants and do the cosmetic work. As I did that, I realized there's some teeth that aren't necessarily worth spending more money and fixing again. So even when you place the individual implants, do you want to spend money on the other teeth if they're going to have problems 10 years later?
Yeah.
So I went back to school again how to learn this procedure. So there's other versions of this procedure that, in my opinion, are nowhere near as good as this. You wind up wearing a denture for 6 months or a converted denture that's this very bulky appliance. And so using all of my digital knowledge and my knowledge of facial changes in TMJ, mixing that with the implants and then the artistry, I've had many wonderful mentors along the way, and I've taken roses from each one of them, and the Smile by Design bouquet is my own.
That's so sweet. And it sounds like bedside manner is something you take very seriously because this is so personal for you. And I imagine that is just so important when you are a dentist, because a lot of people are really nervous going to a dentist's office for anything, much less something so transformative.
I mean, for me, it is really personal, and it's really important for me to get to know the people that I work with. I want to have that kind of relationship where we can talk about what you need and what you want. And if for some reason along the way we do anything with the smile that you're not thrilled with, let's talk about it and we'll fix it. I want you to have that relationship so you can tell me what needs to be done so I can do it right. And
you want to hear from people if they're fellow Star Wars fans, right?
Yeah, I'm kind of
a big passion for you.
Kind of a geek that way. I come from a family of I have 8 brothers and sisters, and wow. We all grew up watching HBO and Star Wars and Marvel, and because my office is so high tech, people say that we're the Jetsons of dentistry, and I've modeled my office to kind of look like Star Wars in there, because all of our equipment is so high tech anyway. I figure I might as well make it look like a spaceship.
How fun is that? Well, we have learned so much, but let's talk a little bit more about the patient experience. Right now, we want to share Lucretia's story. Take a look.
My teeth were so bad. They hurt all the time. I was spending so much money on just one tooth after another, and then I'd get my teeth fixed, and then before you know it, I'd have to go back again, and it was just a lot of pain, a lot of money. I was struggling with eating. I was struggling with just the look of my mouth, and being out there in the public. For my job, I needed a nice smile, and that's what Dr. Keller has given me. Since my surgery, looking in the mirror has given me so much confidence, that I'm able to, get out there, speak with people. My children just absolutely love my smile, my new smile. They're very proud of me that I did this for myself. There is a possibility, there is a way. You got to look for that way. And that's what I was able to get coming to, see Dr. Shawn Keller.
Her story really illustrates how much of an investment into not just your teeth, but just your whole lifestyle this is.
My favorite part of this is watching the new person that's waiting to come out.
Yes.
When you're, besides just the health aspects of it, when you're embarrassed of your smile, you don't smile big. Other people don't know that you're embarrassed or maybe have some shame with your smile. They just think that you're a closed off or grumpy person, and that affects every relationship in your life.
Yeah, it could affect your job, it can affect dating. I know that one of your patients said it was affecting her relationship with her grandchildren even. So yeah, it's so much more than just what's physically happening in the mouth.
Oh yeah, it's really, really powerful. It's not uncommon for a patient to finally start dating again, and a bunch of our patients have gotten married. Maybe it'll help you keep your spouse that you have.
Yeah, maybe, especially if you aren't giving off a friendly vibe because you're not smiling at home. Yeah, that's clearly an issue. We are going to share another great patient story, but it's not just you, Dr. Keller, who brings these successful outcomes to life. You have a whole team of really great people on staff.
That's my favorite part of my life right now is doing this 25 years. Early on, it's difficult to run a business and keep a great team together. And I've got, with what we're doing and how powerful it is now, my team loves being there. They've been with me a long time. They'll continue to be with me for a long time. They're like my right and left hand. I couldn't do this without them.
And we spent so much time talking about how great your staff is, and then all of that incredible technology, and people may be wondering, this is top tier stuff. Can I afford this type of procedure? What would you say to them?
I'd say, I know you're wondering if you can afford this. I'm almost saying you can't afford not to do this. I know that sounds cliche, but if you're having dental problems and you're in this boat where you're a candidate for this, the alternatives are the massive bone lifts and sinus lifts and bone grafting, implants, waiting a year. The amount of procedures, the alternative is not good. So yeah. Most of our patients finance this.
Okay.
So I think that almost everybody buys a car every 5 to 10 years. This is about the cost of a car.
One of the things I wanted to ask you about too is the fact that there are, of course, competitors. There are other people who do this procedure, so you could get a similar result. But those technology differences, what you're able to provide right there in your office, it's going to make a big difference in the process for really the same price, right?
Yeah, I've decided to try. There's the market set for this kind of thing, and so of course I like to think I'm the best. You want your dentist to think that he's the best.
Yes.
And if I think that there's anybody doing it better, then I'm going to go get to know them and learn from them too. And so, yeah, I really feel like our place is the right. You at least owe it to yourself to come in and have it's a complimentary consult. See what the latest and greatest has to offer for you.
Yeah, because your technology is top tier. You can cut down on that time, like we were just talking about, and that's so worth at least exploring with that consultation.
Yeah, and I'm doing this in my city. I want to be able to walk up and down the streets of Kirkland and Seattle and see my patients that I fixed and keep my head held high and know that I did right by them.
And be really proud of it, yes.
Some of these corporations that are out there, the doctors move in every couple of years, and there's different ones that are in there, and part of the reason they do that is because the guy that did you isn't there anymore.
Yes.
So I've been here for 25 years. I'm going to be here for 25 more, at least. I have to pay off my building.
Well, that's fantastic to hear and great to know for anyone who is a potential patient. And we've loved hearing these patient stories throughout this show, and we want to share one more. This is Craig.
The year before, I had to pull out, I think it was about 4 of my back teeth because they were in that bad a situation. Since then, eating became more and more of a problem. I'd be using more of my front teeth to do what the back teeth should be doing, and so it takes an effect. I'm sure it did. We come across Shawn Keller's ad, and we had a need for it because our teeth were in that situation. So I think the thing that caught us was that the time frame that you could get it in a day. That was a catch. So I was like, what, really? I mean, we know the process is longer than that, but to get new teeth in a day like that, it was like, wow. I love Doctor. I love his energy. I love his enthusiasm, and he was high tech. I think he was up to par as far as technology, and I thought, hey, people are coming all over the world, all over the nation to come see him, so he must be doing something right. He had 20 years under his belt, so I said, I think it was right. It was the right thing to do. Oh, wow. That's crazy.
Oh, I love seeing him look in that mirror.
Yeah, that's a really exciting part. So I think if you're watching this and you're thinking that maybe you would like to find out more about this, give us a call and schedule a complimentary consultation. There's a lot of reasons not to do this. People are afraid of the dentist. They're worried about the discomfort afterwards. They're worried about the cost of this. They're worried if it's going to last. I've really dedicated my whole office and process towards taking care of those. You're going to sleep through everything that we actually do. We do sedation so you're asleep for it. Because of our stem cell therapy that we use while we do it, there's very, very little discomfort while we do it. Most of our patients aren't even taking their narcotics after it. A little ibuprofen and they're done. We have financial plans to help out with the cost, so you can spread the cost out over time and get the dentistry you need today. And there's no reason not to come in and find out more.
Well, it has been a pleasure learning all about Same Day New Smile with you, Dr. Keller. Thank you so much.
Thank you, Kirsten. I'm excited to meet you soon.
Yes, so go see Dr. Keller. If you want to learn more, we have information right here for you on the screen, and you can go to ShawnKellerDDS.com. Thank you so much for watching, and we'll see you next time.